Hello, I am Dr. Sreenivasa Murthy TM, an ENT consultant practicing at Malleshwaram. I practice at Columbia Asia Referral Hospital, Yeshwanthpur and Sreenivasa Specialty ENT Center in Malleshwaram. If we get to know the reason as to why somebody has the noise being produced, then we will be able to give solution to that patient to a great extent. So our efforts in the clinic, when a patient comes and tells us that they have noise in the ear, is to evaluate whether they have simple problems like an infection in the ear or fluid accumulation in the ear or wax accumulation in the ear. All these things can simply be solved and they will have immediate relief. Supposing it is the middle ear which has got affected, there is fluid in the middle ear, or the bone in the middle ear has become thick and it has got stuck, it's not moving as well as it should, then that can be diagnosed with certain audiological tests. And in those patients, on doing surgeries, a majority of them the problem can be solved, but we cannot assure that every person in whom we do surgery, in them the tinnitus will vanish. Now third is inner ear problems. Now in inner ear problems, again we need to know what are the different types of inner ear problems which can cause tinnitus. Largely inner ear problems can present with hearing loss. Now when these people have hearing loss, they need to be amplified. In the sense, we need to provide them with aids with which they will be able to hear normal ambient sound in the environment. Once they start hearing those sounds, what we have noticed in our practice is that their perception of this extra noise in the ear comes down significantly. Lastly is to try and rule out whether there is a brain tumor. Now we don't rule out a brain tumor in every patient who has tinnitus, but a patient who comes to us with one-sided tinnitus and says the tinnitus has been progressing plus or minus, that is he develops some amount of giddiness or whether hearing loss all on one side, then we are a bit concerned. We need to rule out a tumor called as a vestibular schwannoma, which can occur on the nerve of the hearing called the eighth nerve, and hence most ENT specialists will be recommending that the patient undergoes an MRI of the inner ear with contrast. Now once this is done, we will be able to rule out whether they have a tumor. The effort here is to try to rule out something which can be life-threatening. Now in all these conditions, some people will have relief once we give them treatment, surgically or non-surgically, but some may not be able to benefit with either surgery or not. In a sense, we remove the tumor, but the noise may persist. We do the middle ear surgery for otosclerosis, but the noise may persist. We do give hearing aids. So long as they use hearing aids, they will be fine. But once the hearing aid is removed and they go to sleep, then they will again persist to have noise. So what we can do as clinicians in sitting in a clinic and attending to patients is to reassure them that these are not life-threatening problems, and other than the tumor which is in the brain, all other conditions are not life-threatening problems. How we can help them cope up in their daily life and help them lead a normal life, and probably encourage them into what is called as tinnitus rehabilitation therapy, TRT, and encourage them to learn certain techniques of yoga which will help them concentrate in a way that they will be able to get their minds off tinnitus. I personally haven't found too much of benefit with medication, so I don't tend to give medication for patients who have tinnitus. I largely depend on meditation techniques, yogic techniques, as well as tinnitus rehabilitation therapy rather than medication.